Hi, everybody, and welcome to those who are online. It's good to see you all, and a huge welcome.
Can you run in and get the water?
Such a pleasure to have you here. I'm Anne-Marie Tho. Welcome to the University of Sydney's Leeder Centre for Health Policy, Economics and Data. I'm delighted to be co-hosting this seminar with the School of Public Health, with the Charles Perkins Centre and the Law School. I trash. Other good governance note, I think it's possibly also co-hosting. So as we begin, it's really a privilege to have the chance to pause and acknowledge that we're meeting on the unceded lands of the Gadigal people of the Eora Nation, on which the University of Sydney's main campus rests, and to take a moment to remember and to really be thankful for the deep wisdom, particularly about food, that the Indigenous peoples of Australia have nurtured over millennia. So with that, I'm going to hand to Dr. Phil Baker, who is now at the University of Sydney, and still such a pleasure to have got Phil to come all the way to this, to these gorgeous lands. So I'll hand to you, Phil, to introduce Francesco.
Thank you. Thanks, Anne-Marie. Thank you, Anne-Marie. Thank you to all of you for coming today to hear Francesco speak. Thank you to the Leeder Centre for hosting in this beautiful building and auditorium. Thank you to the Charles Perkins Food Governance Node, Belinda, Ali, and others. And most importantly, thank you to Francesco, who's agreed to join us here today, and to Cal, Chris, for coming up and bringing Francesco over to Australia. Francesco has been at the centre of global nutrition policy, politics, technical work for quite a number of years now. Many of us have worked with him, heard him speak. He was one of the architects of the UN Decade of Action on Nutrition. I think that's how we originally connected, through some of that work, and also traversing some of the recent UN Food System Summit work and this intersectionality between nutrition and the food systems, sustainable food systems era. So huge wealth of experience, not to mention food environments and all the work that WHO has done around healthy food policies, and increasingly the work that's being done on ultra-processed foods, which I know Francesco will talk about today. After leaving WHO, Francesco has been appointed as an invited professor at the University of Geneva. He's worked as a senior nutrition scientist at the Italian Food and Nutrition Research Centre, and was president of the Federation of European Nutrition Societies. He finished medicine and surgery at the University Cattolica del Sacro Cuore, I'm pronouncing that very correctly, in Rome, and obtained a doctorate in nutrition at Aberdeen University. I'll stop talking and welcome Francesco to the floor, and very much looking forward to your talk. Francesco will talk for 40 minutes, and then we'll have 20 minutes or so for Q&A. Over to you.
Thank you very much, Phil, and thank you, Anne-Marie. Can you hear me, or can people hear me on the?
We can hear you.
Yeah, they should be able to hear you.
Okay,
Yeah.
right.
And if you stand, maybe use the camera.
Oh, I should look into where here?
Oh,
The camera is there. Okay, good. Thank you. Good. Nice to meet everybody.
No, it's fine. We'll move. We can move the camera.
Ready for that? No.
Sorry.
Okay. Anyway, thank you very much for the invitation today. Thank you, first of all, to Vic Health for having brought me to Australia for about a month to learn about the work that you're doing in public health nutrition, which is absolutely remarkable. So for me, it's been a great learning exercise. But I'm happy to share my thoughts and my previous experience with you all. So Phil and Anne-Marie have given me a humongous task to tell you about, the past, the present, and the future of food system and nutrition. So I'll do my best. And as Phil was saying, I've been particularly involved in the setting up of the UN Decade of Action of Nutrition, 2016, 2025. So we're in 2025. So I think it's appropriate to take stock. I did actually have an assessment at the invitation of the World Public Health Nutrition Association last year. But anyway, just to give you a little bit of a background on the decade, I think what was really important was to meet in 2015, I think it was, in Rome, where FAO and WHO joined forces to call a second conference, international conference on nutrition. And it was a very interesting process because we were able to bring two constituencies together that normally don't speak. And these were the constituencies of the Ministries of Agriculture and the constituency of the Ministry of Health. We were having, at that time, you didn't need to have the virtual conferences, but we had a lot of virtual conferences to exactly facilitate, the bringing together, 194 member states. So you can imagine each time, 400 people in the room to discuss a policy document. And I do believe it was a very important conference because it somehow first decided what the scope of the work on nutrition should be. And, the world has changed, and it was a first opportunity to take on global nutrition targets and also on the non-communicable disease target, dietary related. So, it was basically an opportunity to say, okay, this is what we have to do in nutrition. And then the second element was to recognize that you cannot address nutrition in a single sector. You need to generally address it in specific sectors. And, there's something to do for each sector. And, the document that came out of the Second International Conference of Nutrition contained 60 recommendations and addressed to the multiple sectors. After that, when you have a big conference like this, you're left with a, declaration, and that's it. See you at the next conference. So we thought, why don't we try to have something which is sort of an ongoing mechanism, trying to build collaborations. And then we said, okay, one thing would be to create, a mechanism, which is something that happens in the United Nations called a decade. You have decade of water, you have multiple decades, but not a decade in which you have each year a topic and you have a lot of advocacy, interesting discussions, but something which actually has some potential implementation systems, particularly the accountability, because, when you have a decade like this, you have to provide a report every second year to the General Assembly. So you do have a discussion in New York, General Assembly, meaning not a specific topic, not the World Health Assembly only, not the FAO Food Council, but, something which is truly intersectoral. So that was the challenge. And so the idea of the decade was to accelerate the implementation of the commitment and to achieve the global nutrition and diet-related NCD targets. Of course, at the time, the SDGs were still not on the map, but it was a time when it was developed. So it was timely because then the SDG 2 does contain that broad understanding of nutrition. When SDG were formulated, they were relying on the ICN to basically develop the vision there, right? So we said, okay, 60, it's a bit too complicated. Why don't we try to aggregate some of the recommendations? And basically, we created. I probably would do it slightly different today. So, but it was about sustainable, resilient food system, and maybe connected to that, you go to number 5. Safe and supportive environment for nutrition at all ages, the food environment, health systems, social protection, trade and investment, and then, the accountability, right? So I was telling you about the 6 global nutrition targets. They are stunting, wasting, anemia in women, low birth weight, childhood overweight, and exclusive breastfeeding. The rationale there is, the malnutrition, of course, stunting and wasting. But, we need to acknowledge that there is an issue around micronutrients, and, particularly women are affected by anemia. That's not recognized. And so could we profile that element there? But low birth weight as an element of the intergenerational cycle of malnutrition. So low birth weight is, in fact, the result often of women's malnutrition and women's anemia, but it's also the precursor of stunting and wasting. And then overweight, again, an emerging condition. We decided to go for child overweight, but also because there is a separate overweight and obesity target in the NCDs. At the time, the World Health Assembly had defined some specific objectives. And, the story I would like to tell you today that, I've called it, the half glass and the half full. And you know that if you have the half glass and the half full, of course, the picture is exactly the same. So I'm using the same picture throughout. And I'm going to start with, maybe before I do that, I should say that, what we should really proud of collectively in nutrition is that we have achieved some of those targets. In the breastfeeding targets, which is this one, say, we started from 37 and we had a target of 50. And that target has largely been achieved. Probably we're going even to surpass it. So that's incredible. That's a good achievement. Stunting, I would also say that we've done some good work on stunting, and the target was to get to 40% reduction in the number of children stunting, so going from 180 to 106. And remember, this includes also the demographic changes, because if it's the number of children, we also have to consider that demographic changes raise to increase those numbers. Anyway, what we are probably going to get is something around 140, which is not fully achieved the target, but it's 40 million children with stunting less. So that, I think that's an important achievement. Wasting, some improvement, not as good as we wanted. It's too far. What we have not been able to do is to really address anemia and low birth weight. I mean, overweight in children, if you see, it sort of managed to stay stable, and we can talk about that. But it's not one of the greatest. It's not really a failure. So that's somehow the half a full glass. I would say the half full glass is breastfeeding, stunting reduction, managing to sort of keep at least childhood obesity at bay. And what we have not been able really to do is anemia and low birth weight. All right. So let me tell you about the half glass. What I think we can really say it's been a good achievement in these 10 years. Now, I'm not saying it's a good achievement because of the decade. I mean, the decade, it was just a way to, as I said, to keep alive a series of recommendations and a vision about food and nutrition. And I think to a certain extent we've been able to do that. In the middle of the decade, there were a lot of other things that were happening, which have also been dramatically changing the landscape. One of them has been UN Food System Summit, and another one has been the two nutrition for growth, commitment opportunities. And, some of them have sort of gone in the same direction. Some of them have not gone in the same direction. And, we need to be aware of that. So what I'm telling you is what I believe collectively has been, the impact of the work that we've been doing in these 10 years, part of it directly attributable to the decade, part of it attributable to the other processes that, that were living there. So, we didn't expect the decade to be, a secretariat to be necessarily a way to organize everybody's work, but it was, a way to really define particularly the narrative on nutrition and food system, the way we've initially defined in ICN2. So, what has happened in the food system? Yeah, I think, after many years, we've been able to come with a good definition of a healthy diet, which is accepted both by WHO and FAO. It took me many years to get to an agreement there, but we can now say, based on a lot of work WHO has been doing on developing systematic reviews on diet and health, but healthy diet should be providing essential nutrients to prevent deficiencies and promote health, should be balanced in energy intake and energy sources, should be moderate in the consumption of certain foods which are associated to detrimental health effects and should be diverse, including a wide variety of nutritious foods within and across food groups. So I think that's something which is now there. It's established, despite some of the people. I always say that. Mr. Peter Backer of the World Business Council of Sustainable Development had the gut to say, better to concentrate on the health of the soils because there's no agreement among the sciences about what a healthy diet is. That's not true, okay? Right. I think another element was to define that actually, probably this was not in the original definition at the ICN2, but food systems have an impact on health through multiple pathways. And one pathway, these guys here on the right, one pathway is, of course, unhealthy diets, food insecurity, and malnutrition. But then there are other pathways. You can get sick from food system because food is unsafe. You can actually have an impact on health through the transmission of infectious diseases from animals to humans. In fact, most of the pandemics, if not all, come from animals and from the way we actually source the food. Either it's from bush meat or from intensive farming. I mean, if you're looking at what's happening now with the H5N1 epidemic in the United States, and the poultry they had to kill, and the transmission to livestock as well, and in milk. The pathway of environmental contamination, chemical contamination, but also the overall impact through greenhouse gases and use of fresh water. And of course, the occupational hazard. So that to me is another, let's say, good, important achievement we have had in these years. The third important concept in this space is an understanding of the bidirectional impact between food system and climate change. On the one hand, and this was somehow established, and of course not everybody believes in it, but now this is not only based on modeling, it's based on real data. We do have an impact of climate change on productivity, nutritional content of crops. So this is actually one of the reasons why we've had a number of food crises, particularly if you look at some of the effects of the El Nino on droughts in Africa, for example. So that's one element. But we also have learned that the reverse is true. So the way that food system is designed is actually producing an impact on greenhouse gases. In fact, food system is the second large actor responsible for greenhouse gases. It's connected to the use of fresh water. 2/3 of fresh water is used by food system. It's the use of land and deforestation. So there is this bi-directional impact between food system, and I think that's now been recognized in the documents, in the ministerial declaration at the Conference of Parties. In the agriculture, although they're not, I think the story is not very well defined, but at least in Dubai, the Minister of Agriculture declaration was recognizing the importance of the impacts on food security, and the Minister of Health declaration was using the term sustainable healthy diet, somehow recognizing the import of a diet which is not only healthy but is supporting planetary health. So this is, I think, again, FAO and WHO joined forces to develop this idea of sustainable healthy diets. I was telling you that, during these 10 years, a lot of things happened. And I think one important process was the UN Food System Summit. It was convened the first time in 2021. There were 2 stock takings. One is actually happening next July in Ethiopia. And the stock taking is basically trying to follow up on some of the recommendations, trying to profile the changes that countries, particularly countries, have made. In 2021, the Secretary General defined in his summary 5 areas for action: nourish all people, boost nature-based solutions, advance equitable livelihoods, decent working in part communities, build resilience to vulnerabilities, shocks and stresses, and accelerating means of implementation. Very, very general, pretty general. There were a number of coalitions established, and all constituencies made a commitment there, except one who had who decided basically to step out of the process. And there was a whole civil society community, because it was felt that somehow the summary, despite the incredible engagement pre-summit, but it was felt that at the summit, somehow the solutions were more or less biased towards favoring an industrial set of solutions. And, all the work of indigenous communities, local food system wasn't recognized. And so, they've been out of the process for this last 4 years. Just put there, what food producers expect from the UN Food System Summit, and what the business community was saying that they would do. And I think, one could, first of all, you could see the language is so broad and so generic and so general, so very difficult to build any accountability there. But, I really would like to see and, call those actors really accountable, because I don't think there's been a serious action in any of those points. Anyway, I said I would do the half full now, so not starting with the criticism. Okay, so I wanted to say something about food environments now here, and what I think we have now general agreement about is that there should be a series of policies that shape the food environment, and those policies should be regulatory. The Decade of Action final document was left open. So, while the Rome Declaration was signed up by everybody, the 60 recommendations were not signed up. They were left open. They said, okay, we'll keep it voluntary. Right? What does it mean? And then we were asking countries to commit. Okay, voluntary. Okay, what do you volunteer to do? Very little, policy commitment. I think having policy commitment is super difficult. Even at the World Health Assembly, some of these food environment policies were not signed up by all countries. Particularly the NCD, non-communicable disease resolution, was not signed up by the United States and Italy, because they were particularly in disagreement with one policy element: taxation of sugar-sweetened beverages. So what WHO did was to develop a recommendation, basically analyzing the science around these policies, and develop recommendations. So it's a secretariat contribution, so we didn't have to have the consensus of member states. So here's what we've done. Taxes and subsidies to nudge consumer choices. So implementation of a policy to tax sugar-sweetened beverages. Also, policy to tax food inconsistent with a healthy diet, and potentially providing subsidies for foods that contribute to a healthy diet. Although the level of the recommendation is different from the first one to the second and third, because of the availability of the evidence. A lot of countries have done some good work on taxation of sugar-sweetened beverages, but not enough about food. Colombia is a pioneering one, for example, for the second one. But we need to have more countries to be able to make that more compelling. And what WHO did was not only to develop the guidelines, but to somehow develop the tools, because often policymakers are stuck because they, the details are important. How you do this, how you connect it to the existing judicial system, law system, for example, but also because, the way you implement the taxation can bring completely different results. I mean, if you look at, the way that countries are implementing in the world, you will see that in some cases you have, good reductions of the consumption. In many cases, you don't. But, there is a reason, could be related to the nature, the way that tax is designed. It has to be potentially an excise tax. depends on the amount. It depends on the fact, the best taxes are the ones which are linked to the amount of sugar in the products, not yes or no. So, which is called tiered structure. So I think having these two was useful, but also trying to understand what kind of policy objections are given to the establishment of the policy, and try to basically do what do you call it, myth busting. Yeah? And we developed a series of policy briefs in which we explain this. One, for example, is, but if you have this policy, you're going to basically affect employment in the sector. It's not true. There's no evidence for that. Or you're going to hit the poor and then affect their purchasing power. True, but the people with low income are the ones who are actually most affected by the health impacts of consuming sugar sweetened beverage. So it's actually important that they reduce more. It's not a negative, no? This is what's happening now. This latest assessment, 188 countries are implementing the tax. The tiered one is only 1/5 of them. And you're seeing certain part of the world which have a large consumption are not having any color. They meaning they're not really considering the tax. Right. The other important area is marketing food to children. Again, the recommendation that regulations are established. In the past, when we used to have the WHA resolutions about policies, we couldn't have the regulatory, because some countries would oppose it. Say, no, it has to be any possible approach. But we know that voluntary regulation don't work. So this recommendation clearly say mandatory, children of all ages, use a nutrient profile that is developed by government, look into the persuasive value of the adverts. For example, Chile, the regulation in Chile is preventing the use of cartoon characters. That's very persuasive. The little gifts, those policies should consider those approaches. And then policies should not only look at the traditional means. Now the advertising companies are using much more advanced methods, using digital, particularly technology and artificial intelligence method to target individuals on marketing. That has to be regulated. Then the important one is also the provision of healthy public food procurement and service policies, providing healthy food in schools, in hospitals, everything that goes with public money and on public grounds. And this could be done at all levels of legislation. It could be done at national level. It could be done at city level. So there's an incredible potential to work there. And in front of the pack labeling, I know you're discussing this in Australia right now. This is becoming, not yet, but it's becoming a WHO recommendation. These are just the guiding principles that were also taken up by the Codex Alimentarius. But the concept there is that people need to have clear interpretive labeling in front of the pack, easy to understand, without barriers of literacy. And so anything which is pictorial, of course, it has to be connected with adequate nutrient profiling models in line with national dietary guidelines and based on consumer testing. The 5-star system do qualify for that, as well as other systems like the warning systems in South America. In fact, the warning system have been really shown to be incredibly persuasive and to reduce the consumption of sugar sweetened beverages or other unhealthy food. But the labeling is another one. I think some interesting things happen also in the context of, in the space of reformulation. The space of reformulation is a little bit tricky because on the one hand, there's something which is a message to industry, change your products. Phil will say, you change, it's a cosmetic change. You reduce trans fat, but you have the same product. But still eliminating industrial trans fat in the products, I think is an important progress for public health. And I think this is an achievement. Industry made a commitment, but in reality, what has really changed the landscape is the establishment of regulations that ban trans fat. And now we have half of the world covered. We still have a lot of work to do in low-income countries, but I think that's an important achievement, particularly for cardiovascular risk reduction. All right, this is still the half full. So what did we do in health systems? Well, health system and healthcare, I think there's a couple of important progresses that have been made. One, I think it's been a good work done on wasting. And, there's been a WHO guideline on wasting. There's been a global action plan on child wasting. And there's been an investment both in the provision of care. And, this slide there is, the provision of ready-to-use therapeutic food that UNICEF is really responsible for. I mean, you see, big scale up, more suppliers, so more children are reached. Only not all children, many more children, but perhaps still half of the children who need this kind of therapeutic response do not get it. And I'm afraid this number is actually going to go up because USAID was providing a lot of the funds for that. They were providing $1 billion for wasting. But anyway, this has been a good advancement also because it somehow is connected the treatment with the prevention. So we're talking about preventing wasting, with actions on water, sanitation, healthcare, food security. The other good story is increased breastfeeding rates. I told you at the beginning. You see the countries that have a green color have had an increase of more than 10 points. So, probably those numbers have increased because China did a fantastic job in promoting exclusive breastfeeding. Other countries did a small increase, even, in some of the high-income countries. I think the high-income countries still are actually lagging behind the others, but there's been some progress. There's also some very small areas of decrease. But I would say, I wanted to put the list there because I think this has been really a collective achievement, and the establishment of a global breastfeeding collective led by UNICEF and WHO. But, you see how many particularly NGOs are part of that. And so it's been a collective effort from UN, civil society, and governments who have, for example, had more regulations on marketing food to children, had more support for breastfeeding in healthcare structure, has been having, more opportunities for women to breastfeed in the workplace. So, accumulation of little progresses have actually led to this, which to me is a sign, very important sign, because, if we have a clarity about the policies, if we have the alignment about the policies, if you have the collective of actors supporting us body, you have change. Right. I mean, the other one, maybe this is, I'm proud because we started it, but, we are very far from addressing obesity, but we have set up an initiative at last to scale up the action against obesity. We have 31 countries that are now involved there. And we were on the verge of having Australia there, but, we're still not quite. I think in these 10 years, another important thing was to have Nutrition for Growth Summit. And both summit, the Tokyo Summit and the Paris Summit, which has just been convened at the end of last month, have been a great opportunity to do what the Decade of Action wanted to do, to get country commitments. In fact, we said, okay, commitments. Okay, fine. If the Nutrition for Growth Summit is going to look for commitments, we won't bother. I mean, we will just help that process. And I think it's been a good process. financially, it's been an important commitment process. I mean, you can say whatever. I mean, it's the old money recycled, but $27 billion. The Japanese did a bit better, but I think it was 41, if I recall correctly. So it's a good investment. I think it's also reassuring to see that somebody is going to put the money, for example, in the management of wasting, and commitment made at N4G in Paris was also related, for example, to sustainable food systems. So there's been a combination of food and health, which was the original intent of the ICN2 and the Decade of Action on Nutrition. It also mentions social protection, and note that. So I think the intentions are good. So now, very recently, the General Assembly said, okay, we finished the Decade of Action on Nutrition, what do we do next? Well, since we don't know what's going to happen after 2030, we cannot really make a long-term commitment. Just, get 5 more years. So get to those targets. There's been a redefinition of the nutrition targets, basically saying breastfeeding, obesity, we've done something good, let's go further. Anemia and low birth weight, we've done nothing good, continue and do better. Stunting and wasting, keep the same target, but accelerate the action. So that's where the half empty part is. So I've said 7 things. I mean, sorry, this is not necessarily super well structured, but 7 points where I think we need to reflect on accelerated action. Number 1, how am I doing with time action? Okay, good. So that's fine. Good. So the number 1 is, of course, obesity. I mean, you've seen this was published last year in the Lancet. It's for the first time we can say that we have surpassed 1 billion people. 1 billion people with obesity. This is not overweight. This is obesity, right? And the adults, about 800 million. But the school-age children and adolescents, I mean, that's dramatically. And of course, it's everywhere in the world, not high-income countries. In fact, probably the largest in proportion increase is in low and middle-income countries. So that's the first one. We need to really do better. Second, I told you, anemia and low birth weight. These are the trends we've been doing all sorts of modeling, trying to understand, in theory, the line below is where we should have gone with the original targets. You've seen, really completely zero increase. So, the target is going to be the same in 2030. But, this is a call to action. Particularly if we don't address low birth weight, particularly in South Asia. I mean, in India, although, they contest a bit this data. In India, 1 child in 4 is born with low birth weight. That's dramatic. That's all. And of course, this is also related to the fact that they have a high rate of non-communicable diseases because, if you combine the low birth weight with the unhealthy food environment, that's, the reason for, it is completely explosive. It's a reason for a disaster, recipe for disaster, right? Third, well, food insecurity is still going to be an issue. And you see, this is the data on the prevalence of undernourishment, which is calculated by FAO every year. This is a very interesting database. I'm not sure you know it, the Food System Dashboard, which is a lot of both data and on impacts, outcomes, but also policy data. And you see the numbers there. And the darker the color, the higher the risk of the higher the prevalence of insecurity. This insecurity is calculated as in relation to the energy needs. So it's a bit of an incomplete story of food insecurity, but still that tells you that this is still a big challenge for some part of the world. We cannot ignore that. But then where's the healthiness of the diet? Healthiness of the diet, and we're still struggling a little bit on how to define it, but I found this is a useful way. The data coming from the Global Diet Quality Project is qualitative, but basically linked to the adherence to the healthy diet recommendations. And you have two sub-indicators. One is related to the risk of non-communicable diseases, and the second one is the protection from non-communicable diseases. So let's say on the left side, you have, exceeding fat, salt, sugar. On the right one, you say what we don't have enough, right? And so you see where the problems are in terms of risk. You have basically largest proportion of the world population. If you're asking how many people consume a healthy diet in the world, how many? What proportion? I mean, what do you think? Guess. What would be your number? What would you say? What proportion of people in the world consume a healthy diet? 30%. Any idea? 5%. 5%. What do you think, Phil? 10%. Anybody else? I don't have the answer, but I actually think it's less than 1%. I mean, it's incredible. I mean, it's absolutely appalling. Because if you put, I mean, this indicators basically says that the best achieving, which are again high-income countries, get a score of 4 out of 9 as a population. So it means at least half of the population is much below. So how many can achieve? I don't, if you look at the statistics a bit, 5 more minutes. Yes, I think it's really very small number. So, but definitely less than 10%. So yeah, this you remember this one. We have, when we talk about dietary risk, we have to think of the excess sodium, sugar, and we have to think of the insufficient one. On sodium, there's a lot to do. I mean, on sodium, the WHO's recommendation of 5 grams of salt, we're nowhere there. At the moment, we're probably at the level of 10 grams sodium intake globally. And I mean, this is your bread and butter. I mean, the fact that the ultra-processed food consumption is increasing in the world and is really, in many countries, being the main source of energy. Number 5 is the affordability of the diet. And we have 3 billion people in the world who cannot afford a healthy diet. So 3 billion cannot afford, many more do not consume. But the affordability is, of course, a blockage which we have to remove. And Sub-Saharan Africa, Southern Asia, those are the parts of the world where the affordability is lowest. 6th, climate change. And climate change is going to affect food insecurity, but it's also affecting food safety. And this is something sometimes we don't consider. It's going to also, create a greatest burden of zoonotic disease because of the way that our food system is designed. And last one, I really like this word, commodification, because it tells better the story of the political economy of the food system. And I was reading actually a very nice thesis by a person from Uppsala University, and she was actually having these 4 components of commodification: industrialization, corporatization, trade liberalization, and financialization. So these to me are 7 challenges. Okay, what do we do about it? On the right side, you have the current reference framework. So I told you about the UN Food System Summit Action Areas. Committee of Food Security developed after a very complex process, voluntary guidelines on food system and nutrition. We have the WHO best buys for food environment policies. I told you about that. We have an interesting document prepared by FAO called Achieving SDG Without Breaching the 1.5 degree threshold, with a lot of suggestion agricultural policies. A document I also like is the one that Jessica Fanzo and Corina Hawkes wrote about this 42 policies and actions to orient food system towards healthier diets for all. What I think, should be things in which we put more energy. The food environment policies, I mean, they work if they are implemented at scale. So we cannot have, one country here, one country there. Everybody needs to have that. I mean, that idea of the Framework Convention is absolutely critical. Nobody would ever sign a Framework Convention, but that's the way to go. I mean, that package of policies needs to be implemented at scale. We may need innovative solutions. Think of the, zoning policies, for example. There's more regulations that can be introduced, but, we need some scientists who develop those ideas. I think the center you're having, or the collaboration we're having here in Australia on policy translation are absolutely critical. You're doing fantastic work. So more science, but also more champion countries to implement them. Health policies, those nutrition actions, they need to be implemented at scale. Social protection policies that consider nutrition, I don't think there's enough. So the affordability cannot be addressed with price of food. It has to be addressed from the side of the purchasing power of people. Your work on the political economy and food system, I really like that. I think it's really important. And I was telling Phil, indeed, ultra-processed food are the very basic element of that commodification of food. So you don't have any profit without the ultra-processed food, or you have much less profit. So the system is different. So explaining ultra-processed food important. Trade policies, antitrust for competition, the big discussion on subsidies, of course, and conflict of interest. But perhaps what I say is most interesting is local food systems. Okay, I won't talk about conflict of interest because we don't have time. I just want to give you my 4 questions about ultra-processed food. One is a bit more about what mechanisms of actions we not because they are needed to develop the policies, but we need to understand, what also to understand whether there should be some subgroups. I've just learned that poor Kevin Hall, that was doing this very interesting work, has been fired from NIH, but he was trying to understand whether there should be any subgroup, for example. So, for example, is how should we deal with animal source food alternatives, which the environmental community is pushing, but they are ultra processed food. So, what do we do there? And of course, what measures? I mean, are the ones that we have sufficient, or do we need a broader package on that? This is what I would like to see as a food system, and everybody has. This is a market in London, actually. I haven't yet been to the Queen Victoria market. I'm told it's like that. It's like that. Okay. So we need that for everybody, but we need a sort of local food system, which I think you have, to be able to source these markets, and I think that would be an incredibly transformative force. Thank you.
Thank you so much, Francesco, for that wonderful talk. We've just got some sense of what Francesco and the WHO team were dealing with, the breadth, the scope of issues and the intersectionalities across nutrition, across the food system, political economy, all of these issues. Thank you, Francesco, for that tour de force, the synthesis that you've done, and also helping us to think about what are the challenges that we're going to face going forward. We do have a bit of time for questions, 10 minutes or so, maybe we've got a little bit over time, sorry about that, but any questions for Francesco? Open to the floor.
Please also project your voice so people online can hear your questions.
What are your thoughts regarding fortification of foods? Because I know it's been successful with like golden rice and like with iodine and salt, but as far as I'm aware, we do need a food matrix for the absorption of some nutrients. So how far does that go?
So, I mean, there are, of course, some success stories. And as you know, fortification somehow came because we've been using very refined grain flours, particularly US and Canada actually started to fortify their food effectively and return those nutrients. Fortification have been seen as policies to address micronutrient deficiencies. And I think that's where the problem is. So we cannot think that, in fact, when, in countries that have been using fortification policies, some people have received those additional micronutrients, but not the ones who needed them. Because, it's done centrally. And so only people who have access to those central facilities can actually get. So the rural areas, the poor women in rural areas who were the one most in need of the nutrient were, never getting it. So I think it's important. It's important to do it. But also, the way that the policies are done is very different. Also, what's the matrix that we should fortify? Flowers. There's been a discussion about fortifying salt and sugar with iron. Wouldn't that encourage the consumption of salt and sugar? We've successfully used iodized salt as a fortification policies, and that's fine. I think it's possible to actually reduce the consumption of salt and increase the iodization. So that's a situation where it would not be too much of a contrast. But for example, thinking that you double fortify salt with iron and iron, may make things more complicated and could potentially lead to increased consumption of sodium. So fortification policies are an interesting tool for addressing micronutrient needs, but they by any means shouldn't be seen as the solution of the micronutrient shortage.
Francesco, I have a question for you. I'm just going to take advantage of the fact that I'm standing here. There are many students in the audience and who are listening online. And we train a lot of students in the School of Public Health, in the School of Law, right across the university. And our students are considering these questions. How do they develop the skills that are needed, the capacities, the leadership skills, the soft skills, not just the technical skills to really deal with these types of issues, the complexities that they're facing, but also to reflect on your experiences over many years of working in global health, global nutrition, and the diplomacy that you've had to do, the soft skills that you've had to use to convince people that these issues are important, they need addressing. Any reflections on that for the students in the audience, the future, I guess, workforce, dealing with these issues going?
So, of course, I'm biased by my own, personal history. But, whenever I get asked by students about career advice, I say, you need to be able to understand the problems in concrete. So, go and spend some time with an NGO on the ground and try to see what is malnutrition? Why do you have somebody with malnutrition? What is a problem of unhealthy diet? Why people get obese? In concrete. So I think that's a fact element is important. You cannot sit in a Geneva office and pretend to solve the problems of the world. That's not going to work like that. So I think that is the first one. The second element, the diplomacy part. That's a skill that you need to learn, and people interpret it in different ways. So diplomacy doesn't necessarily mean appeasement. Doesn't necessarily mean to have everybody on the same page. We had a lot of fights, and you need to be able to pick up fights. We had fights with governments. We had, of course, diplomatically, meaning I remember once. I had a lot of pushback from member states when I was part of the Eat Lancet Commission. And particularly, I upset a lot my own government, actually, who asked for asked my Director General to fire me. And I remember there was a meeting in which we were presenting, I think it was related to the Decade of Action report. And then the first intervention comes from the Italian ambassador, who take the floor and then start saying all horrible about I had conflict of interest and I was unprofessional. I just kept quiet. I was chairing the meeting. I just kept quiet. And at the end of the meeting of his intervention, I said, "Well, thank you very much, Ambassador. Can I give now the floor to India?" And he probably was expecting a reaction from me. So you need to keep cool. And so I don't know, but this is sort of skills that come. But I would say that in general, understanding diplomacy, you need to be in those contexts, you need to participate. So there has been an interesting youth program in the UN I don't know how it works, but I remember I worked very well with the youth envoy of the UN Food System Summit. So being in that process, I think would be extremely educational for. So try to get access to some of those programs, sit in those meetings and listen, and you'll see, you'll understand. Yeah, those two things perhaps.
Alice?
So much. That was a great presentation. This is probably more of a comment. I think that is what the picture you've got up there is the dream, and I guess increasingly the reality in the modern world is people are purchasing their food online. So it's how do we translate that into a digital world where we can help people make better choices when purchasing.
That's a very interesting question. I would say I would like to give two answers to that. One is it is possible to source healthy food also through the digital space. In Australia, you have an interesting initiative called the Open Food Network, which is trying to connect local farmers to consumers. And one way to do it is to have the vegetable boxes, but another one is through digital system because people, buy digitally. So you can, in theory, have digital systems to do that. There's also ways to actually control, the marketing that happens with digital. In fact, increasing more, there are ways to nudge people towards making healthy choices in the digital space. The WHO had an experience of local application, and by simply having the default food is with low salt, and then having to ask if you want to have additional salt, they were able to reduce the consumption of salt. So you can do things in the digital space. The other part of the answer is, but you buy digitally, you never get out of home. You never get in these places where you meet the producers. I mean, I remember when I was in Rome, it was a pleasure to go on a Saturday morning to a market and speak to the other people and discuss the recipe. So it's the social part there. That I don't have the answer, but I suppose it's very much related, for example, to city design. And I know that, discussing, for example, the design, if your cities are expanding, how do you design your new cities? Are you designing them, the new settlement around McDonald's, the Kentucky Fried Chicken, and a Subway, or do you have a fresh food market in the middle? So, which is maybe connected with local farmers. So there are ways to do that. So I don't think that the digital world is going to entirely absorb us. I hope.
Well, time for one more question.
Hi, it's Margaret. This might be an unfair question, but we're in the middle of an election. And if you were only able to ask for one thing to improve nutrition in Australia, what would you select as perhaps being most impactful?
Well, I think you have a lot of interesting policies which are voluntary. I mean, the 5-star systems is good, but it has to be implemented by everybody. I would go regulatory. The other one is marketing food to children, make it regulatory. Perhaps a third one would be, again, make the school food, something which has certain standards and make sure that the administration is actually empowered and capacitated to make those standards a reality, for example, with the connection of the local food system. Those three things.
Okay.
That's a great question. Thanks. Great question. Well, thank you, Francesco. That was a wonderful talk. Those questions were fantastic. And please join me in thanking Mel.